There is no single way of organizing an OET letter, as each writing task and each case notes are different. The situation you are describing and the requests you are making are not the same. As a result, each letter that we will write will be structured slightly differently. Let's go through some different ways you can put the letter together depending on the patient's medical timeline. Before we begin, please let me introduce myself. My name is Grace Dalgiti, or Teacher Grace for short, to our students. I am the Managing Director and one of the teachers here at SGR. I have been teaching OET for more than 7 years now, and I am the lead OET trainer for SGR Focus Training, which is a company based in Scotland in the UK, and we have 2 locations in the Philippines, namely Aklan and Iloilo. SGR is an OET premium preparation provider in both countries and the first and only premium preparation provider in the Philippines. We offer OET training mostly to nurses, doctors, pharmacists, occupational therapists, and other healthcare professionals who require our support in preparing for the OET exam. For those who are watching us today, may I ask if you could share your name, where you are from, and whether you are preparing for OET as a doctor, a nurse, a pharmacist, or any of the other remaining professions who take the exam. Perhaps share your challenges in OET writing as well. I will give you some time to type that in chat. Thank you very much and glad to see you all in here today. Before we discuss patient's timeline, it is important to go through the various OET writing criteria to ensure you know how your letter is being assessed and how understanding timeline can help you gain a higher score. Timeline is also about the patient's story. We often tell the patient's story when we are doing a handover at the end of our shift, or perhaps over the phone when we are referring the patient to a specialist. Depending on our patient's medical needs and the specialization of the person we are speaking to, we adjust the information we give when we are telling the patient's story. We ensure we tell the most important story first, and the other information that could help are written towards the end of the story. We do this to ensure that they understand what they need to do to continue the care of the patient. This is what we need to do as well when we are writing our letter. So by the end of this lesson, you will refresh your knowledge of the different writing criteria, learn how to understand the patient's situation, learn how to pick relevant information based on patient's medical condition in your reader, and lastly, you will improve your ability to organize your letter based on patient timeline. Let's begin. Let's have a look at the OET writing criteria. The first part of the OET writing criteria is purpose. Purpose is making the reason for the letter immediately apparent. In other words, making it clear why you are writing the letter and why the reader should read it. By starting your letter with a clear explanation of its purpose, the reader does not have to spend time searching for what is important. This is important to healthcare professionals who often are time poor. The second part of purpose is sufficiently expanding. What do we mean by this is that the letter should build on what is initially outlined as the reason for writing by adding relevant details. The next criterion is content. The letter you write should also provide the reader with all the information they need to continue caring for the patient and complete any requests you make of them. How you select this information depends on a couple of questions. First, is there any existing professional relationship between the patient and the reader? Do they know each other? Secondly, what aspect of the patient's care will the reader be involved with? When reading through the case notes, you should keep these questions in mind when you decide whether the note is something that you need to include in your letter or not. Keep an eye out for information that you think is new to the reader and directly supports the appropriate care of the patient. Conciseness and clarity is the third criterion used to score your letter. We tend to pair content and conciseness and clarity together because many of the skills, strategies, and questions you apply are similar. Content is the criterion that assesses the information you have included in your letter. Conciseness and clarity assesses the information you have omitted from your letter. If certain information from the case notes is not omitted, then the important information can become hidden and the reader may end up misunderstanding what is required. Genre and style is the fourth criterion used to assess your writing and looks at whether your writing aligns with the reader's knowledge and expertise. In the healthcare industry, the type of letter you tend to write is formal, and OET's writing subtest reflects this by asking you to do the same. This criterion focuses on the use of appropriate format and style for the specific writing task. It also assesses the consistency of the register, whether it's formal or informal. And lastly, it evaluates the use of appropriate greetings, closings, and overall letter structure. The fifth criterion used by assessors is organization and layout. It covers how you order your letter and helps assessors decide whether your structure makes it easier or harder for the reader to understand. Once you have decided the information to include and not include from the case notes, you now need to decide in what order you will present the information. The final criterion of the OET writing subtest is language, which includes grammar, vocabulary, punctuation, and spelling. Each of these language elements forms part of the assessment criteria. The language criterion focuses on the control and range of vocabulary in grammar and assesses the accuracy of spelling and punctuation. All six criteria are equally important. Candidates should not focus on one area at the expense of others. Understanding these criteria is essential for OET candidates to perform well in the writing subtests. Understanding patient's timeline can help you gain a good score in 4 of the 6 criteria. By knowing your patient's medical history, current and future needs, you will know your purpose. You will be able to pick relevant information. You will avoid choosing irrelevant data that can confuse your reader, and by organizing it well, your reader can easily and clearly understand what you are trying to say. Let's have a look at the understanding of patient situation. Put yourself in the reader's shoes. If you receive this letter, which information would you want to see first, second, third, and so on? Timelines make it possible for complicated and complex information to appear simple and comprehensible. In the field of medicine, timelines are considered as essential. They are a tool in plotting out important medicine-related milestones and processes. In OET, timelines can be used in any setting to help with understanding the order of events and daily trends. Divide your letter into clear, concise paragraphs, organizing the information by its importance to the reader. Each paragraph should begin with the most important critical information. In this example, we are referring our patient to a diabetes specialist nurse. So we start our letter by informing the reader when the patient was diagnosed with diabetes. This structure helps the reader quickly identify key points and understand the patient's situation without wading through unnecessary details. For example, the first paragraph might cover the patient's past condition, the different testing, the different prescribed medications. Then it can describe the development to the patient's condition. This time around, the BSL is normal, and lisinopril was added to the medication. And finally, it also informs about current condition and reason for referral, while subsequent paragraphs might delve into the medical history and treatments tried. Select only the information that is relevant to the current condition, which in this example is diabetes. So for instance, mentioning an unrelated past illness, such as hysterectomy 20 years ago, might not be necessary unless it has a direct bearing on the current condition. Let's have a look at patient number 1. We can see that our plan is to refer her for further management of her sugar levels, which means this is uncontrolled. Our reader is an endocrinologist. Our timeline includes 6 dates from 29 of December up to February 2019. We predict this is a diabetes condition, so we look for it in our case note. We see that she was diagnosed with NIDDM in 1999, and we will add this to her timeline as this explains how long she's had this medical condition. From here, we analyze what happened in each timeline and make a summary on what information the reader needs, your endocrinologist. And we also look at our patient's medical care requirement, which is management of uncontrolled sugar levels. From here, we can see that December 2018, the patient was worried about her glucose levels. And then in January 2019, we received the result of the pathology, which shows that HbA1c is very poor. And this was discussed to the patient a week later. And the decision was made to make changes to her medications. By the end of the month, we can see that medications are working. Her sugar has improved and her BP is in range. A new pathology was requested. The result showed that her fasting sugar is in the high range, which you have reviewed with the patient on the 10th of February. You have decided to refer her to the endocrinologist for management. In some situations like this, where the patient's situation is quite routine to the reader, endocrinologist managing an uncontrolled sugar level, then the clearest way to organize the letter is around time. This is a chronological organization style. You start at the beginning and you continue up to the present day. The writer uses dates at the start of each paragraph to separate the details of her visits. By doing this, the information is formed into a timeline that is clear to the reader and easy to follow. However, you will notice that the 5th and the 12th of January are both discussing the same topic, the pathology result. So we write about them together rather than separate. We do the same thing for the 6th and the 10th of February. Now you are ready to finalize planning and write your letter according to this timeline. Let's look at another patient. Patient number 2 is a non-compliant patient, someone who doesn't follow advice from his medical team. He double doses and misses on medications, and he refuses to change his diet regimen. His timeline showed 7 dates. His diagnosis with NIDDM in 2016 and up to the present. When we look at this timeline, we can see that this is all about diabetes from 2017, where his wife was managing his diet, to non-compliance to diet since his wife died. By March of 2018, he continued his non-compliance and metformin was then prescribed. 3 months later, he was hospitalized for heart attack and was also diagnosed with atrial fib. His non-compliance continued. He is now showing signs of diabetic neuropathy. And at the present time, the family decision is to move him to another city to live with his daughter. His daughter will need education about her father's care, and the patient will need encouragement to comply to medication and diet. From this timeline, it is clear that diabetes is the main condition and MI and atrial fib are secondary. For this type of case note, another way to organize the letter is by putting the most important information first. In these situations, presenting the information thematically will be most appropriate organization for the reader. You would organize the letter this way if there are a number of different aspects to the patient's current situation. In this letter, there is a timeline of the patient's history, like the last example, because it remains important for the reader to understand what happened and when. However, the information is laid out thematically rather than chronologically. The first paragraph covers the patient's diabetes and non-compliance with both his medication as per the purpose of the letter, which is to write a letter outlining the patient's medical history and requesting ongoing monitoring. The second paragraph basically talks about the heart attack and the atrial fibrillation, okay? So in other letters, thematic paragraphs could focus on patient's social history, previous advice, education that they've received, relevant family history, and the impact that these have on the patient's feelings about their condition. So in this type of letter, doing it chronologically would really make it quite confusing, just because there is something different that happened right in the middle of the timeline. So the best way really for this one is to split them into two. Paragraph 1 will be all about diabetes, and paragraph 2 will be all about MI and atrial fib. Let's look at our last patient. We can see from the case note that the patient has two timelines. One for what happened to them while they were admitted in Green Valley Hospital, and the other during the home visit of the nurse. We also note that our reader is an ED consultant. This suggests that this is an emergency situation, and we can see that the plan is to transfer the patient urgently to the nearest hospital. If the case notes you are describing is an emergency situation, what happened 6 months ago at the initial visit becomes much less important to the reader. This means that our priority is actually the timeline today. So ED is more interested in what had just happened, what treatment has been provided, and the details of the patient's current situation. Once they have this in mind, they can then scan through the rest of your letter to see if the previous history, which was the Green Valley admission, still presents any additional insight. So from this point, because this is an emergency situation, always bear in mind that what happened today would be more important. So we would then put the nursing visit on the 30th of August as the primary paragraph, with the secondary paragraph focusing on the Green Valley admission. So for this type of letter, wherein it's describing an emergency situation, the urgency style would be the most suitable organization. Start with what happened today and then support this with historical information for better clarity. Now that we know our purpose, we pick what's relevant, we omitted what are not relevant, and we have a planned organization. So let's now have a look and see how we can write our letter. So in the chronological style, we write our introduction, then start the body paragraph with the diagnosis in 1999 and the relevant information about the patient. As our patient is an endocrinologist, you can see that we chose vocabularies and information relevant to them, such as NIDDM, diabetes, BP, sugar level, BMI, and eye examination. Remember that eyes and feet are common concerns in diabetes. Then our next paragraph includes the visit in 2018 and the relevant information to a high sugar level, which is the BP readings for that day, the sugar level readings, and the medication. This is followed by the pathology report and the discussion in January, plus the medication changes. Then we inform that because of these, sugar and BP improved. Unfortunately, further testing result that show the fasting sugar is still a concern. And we then decided to refer the patient to a specialist. Okay. So in this letter, you can see that the chronological style works. Past history of the patient, the changes from before to what's happening during the previous consultation, the development of that condition up to the present time. In letter number 2, which is the thematic organization, our patient has 3 medical concerns. We've got the diabetes as the main one, the secondary are MI and atrial fib. So we put all of the diabetes timeline in one paragraph. And you can see that this timeline basically starts from the diagnosis in 2016, and then moved on to the information of the non-compliance, the prescription of metformin, to the continued non-compliance for both diet and medication. And then it talked about the most recent one in terms of diabetic neuropathy, which was last October 2018. And then the current and future situation we're in, the patient will now be moving on and moving to another city to live with his daughter, and that the daughter will now be required to be educated to understand her father's concerns and how she can help him. Okay, so all of this information about diabetes all in one paragraph. And then our next paragraph basically focuses on the MI and the atrial fib. It shows that, by separating this paragraph, we're showing better clarity and it can avoid confusion. So this paragraph doesn't involve anything about diabetes. This is very particular to the MI, very particular to the new diagnosis of atrial fib, and it also includes all of the medication related to these conditions. So for our last letter, we're going to have a look at the ED letter or the urgency letter. So in here, we put more focus and importance on what happened today. And then we follow this up with details of the previous hospitalization. And then we add relevant background information, anything that is relevant to the condition. And then we close our letter with the request for urgent assessment and management. So typically with today's situation, typically with an ED situation, the today information will be most important. Sometimes you might add a little bit of the medical background in there if it's directly relevant. So say, for example, this is an asthma attack on a child, but there is a strong family history of asthma, then even though that strong family history is actually a medical background, instead of putting it at the bottom of your paragraphs, we would actually include that with the today, just so that the ED consultant knows very quickly that there is indeed a strong history of asthma. Okay, so I hope that this helps you, read your case note a little bit better. Always make sure that you check for timeline in every case note that you're going to read, and always make sure that you review your paragraphs. There's no limit to the paragraphs you include. Use as many as necessary to clearly communicate the information to the reader. Some situations may need less, some situations may need more. If you find you have a very long paragraph in your letter, use the few minutes at the end to make sure it is only covering one time period or one theme only. Decide if you still need to break the paragraph into two if it's too long. And always think about the order of your sentences. It's not just about structuring the paragraphs into the clearest order for the reader, but you also want to make sure that the important details don't get hidden within that paragraph, and apply the same approach to the order of your sentences. The sentence containing the most important information should come first. The next most important should come next, so on and so forth. Making the right choice about which order to include the information is what's being assessed in your criterion. Even if you've included all of the information the reader needs, but not in the order that they would wish to see it, then you probably will not be able to demonstrate, a proper organization and layout criterion correctly. Okay, so thank you very much, everybody. If you need any help with regard to your OET writing score, if this was a struggle before, how can SGR help you get a pass score in your next exam? Giving you a very nice story actually from one of my students. And we've helped many students in the past, just like this one. Our writing pass rate is one of the highest, almost 100% in the first test. Some of our students like this one can be scoring only 250 before they come to any SGR classes. Then once we start writing letters, doing our tutorials, looking at how to improve their weak areas in writing through practices and through our detailed letter feedback, you will notice that, you will start to improve. Okay, we continue identifying problem areas along the way, and we give suggestions for your improvement. And before you take the exam, we're there to let you know whether you are ready. Okay, we give advice, and if we feel that we're still lacking and we need a little bit more time to manage writing, we will inform you. Basically, we're there to support you until exam day, and of course, if you still need us afterwards, we are there as well. And finally, we're very, very happy to see results like this, wherein you come to us with a writing 250, and then after taking the exam, after our classes, very happy to see that with this student, you can see 130 points increase. So from 250 to a writing 380 after SGR lessons. So SGR focuses on one-to-one intensive classes, which starts from 30 pounds. Our one-to-one is a personalized service based on our assessments of your strengths and weaknesses. So we basically interview every student that we have to find out what their previous scores were in the exam, or if this is the first time they're taking the exam. And based on this and other evaluation or assessment, we offer the 45-minute classes, can sometimes extend to 1 hour. You can pick and choose the day and time of your study, and you get access to OET Pass, which is SGR's very own learning management system. Apart from one-to-ones, we also offer writing correction service only. If you feel that you understood the exam already, but just really not so sure why your letters are not getting the mark, then the best thing to do is to book into our writing correction service. We offer as little as 3 letters to as much as 12, and sometimes even more, if you feel you really need a boost of confidence before you tackle the exam. So we get a set of 3 letters, and each set is 45 pounds. And lastly, if you feel you can really study on your own and doesn't need anyone assessing your letter, but we highly recommend the assessment. But if you feel like this is okay, we can provide you with all the pre-recorded video materials, writing materials, sample case notes, explanation of those case notes, and sample letters with details of why and how it was written. The best thing is that this only costs you £5 per month to study with us online. And all of our students, they have access to SGR's in-house design learning management system. As I mentioned earlier, typically you've got anywhere from 130 plus materials if you're studying the whole sub-test with us, okay? And our method works. We boast a high success rate of students passing the exams. By focusing on the fundamentals of language, we equip you with skills that apply to any OET subtest that you find challenging, whether that is listening, reading, writing, or speaking. I hope you have enjoyed this session from SGR Focus Training. If you find OET writing a challenge and you feel that the strategies you learned today can really help you tackle this very challenging subtest, then please do let us know how we can help. To get in touch, simply chat with us on WhatsApp or get to know what we have to offer by going through our website. Join our successful alumni of OET test takers, book your class today, and experience the SGR difference. When you're ready to book for your exam, SGR is also a partner of OET for test booking, so you can use our direct OET link, www.oet.com/sgrft, or simply scan the QR code on your screen. Every successful booking, we will give you a free OET online course. Thank you very much, and good luck in your exam. Bye for now.